Minutes for your questions, please.
Thank you very much, Mr. Chairman. Appreciate all of you being here. As I think one of the previous members said, it's been a long day for you all. We know that, and we appreciate you being here. Ms. Nichols, I'm going to address most of my questioning to you. I represent 22 counties, mostly rural, and 7 independent small cities. The biggest one is about 25,000 people. Smallest of my cities is 3,500. We're all in an area that's underserved for drug abuse and mental health, and so we have problems there. So it is, that's where I'm coming from when I ask these questions, because we don't have enough treatment centers. In fact, in a huge number of my counties, they just don't have anywhere to go. And I had some folks who are recovering and trying to do what they can, but there's no long-term treatment there. So that's where my questions are coming from, and keep that in mind, if you would, with the answers to them. So part of that is, it's obviously important to build a pipeline of qualified healthcare providers that have been trained in substance use disorder treatment and pain management education. And as I understand it, the TEACH Act will help highlight curricula from centers of excellence and disseminate these best practices widely. What types of healthcare workers will the bill educate? And how will the TEACH Act take into consideration the smaller institutions that are educating healthcare workers with limited resources? Because if you're just doing the big ones, you're not going to reach all of my counties.
Absolutely. Thank you so much for that, Congressman. The TEACH Act will help to make sure that we get the right curriculum and training to all different kinds of healthcare providers, from specialty physicians, emergency departments, primary care, pediatricians, nurse practitioners. We need to sort of move this to a chronic disease model, chronic care, and make sure that we have qualified and trained healthcare providers in all different types of settings, hospitals, sort of, you know, in your regular doctor's office or your pediatrician's office, so they can identify and assess and treat substance use disorders more early. This is particularly important for rural communities. Right? You're not going to find as much specialty treatment at very long distances. We're doing work on the ground in a few places like Ohio and rural communities. Very difficult to find medication-assisted treatment, providers that can prescribe the medicines that you need to treat opioid use disorder, and that could do that long care follow-up. And it also is true, we need to have long-term care plans, 12 months, 3 years, 5 years, depending on the severity of that substance use disorder. So the TEACH Act will give healthcare providers the tools that they need to assess, identify, and make sure we build those treatment plans.
I appreciate that. Also, the Comprehensive Opioid Recovery Centers Act will identify some of the best centers in America providing care for addiction and recovery. And from what I understand, these centers deliver the full complement of addiction services. Congress will direct funding to support those centers, and they, in turn, will provide documentation and data on their effectiveness, their models of care, and their collaboration with their communities. Is the goal of the bill to scale up and spread so that there are more centers of excellence across the U.S., or is the goal to lift all boats with the rising tide so that any facility can improve even if they're not able to reach the centers of excellence level? And obviously, when you don't have any, you may need to start with something, even if it doesn't meet the gold standard. We'd like to have something that meets at least the silver standard. But what do you think? Will the bill help with that?
I believe so. I think it could help actually with both. I think creating these centers of excellence so we can really advance what patient-centered care looks like, to take down these silos, to have better coordinated care, and then the lessons learned from these centers to be applied throughout our healthcare systems and to all of the components that we need to treat this illness. So I think it will actually have both effects. We have a lot of rural communities that are struggling with this illness, and we need to have sort of more evidence and more new programs and protocols in place that we can get to them quickly. And I believe the Comprehensive Opioid Recovery Centers bill will help to do that.
I appreciate that. And for those folks who came in to see me, I hope this helps them know that we are trying to find something. And several of those folks, as I said, we're in recovery. I compliment all. It's not easy. Appreciate you, Mr. Hampton. But all those that we've had testify over the last couple of days, there have been a number of people that have had issues who are now in recovery. And I compliment you all. And look, we have to realize there's a lot of talent out there that we're wasting if we don't use those people who are in recovery. And I yield back.
Chair, thanks.